Hello, my name is Dr. Porter McRoberts. I'm with my partner, Dr. Paul Wu, here today.
Hello.
We are both interventional physiatrists residing here in South Florida. And today we want to talk about how to prepare for your visit. We've talked a lot about in this series on interventional pain, chronic pain, spine-related disorders, etc. But something that was suggested was how actually should a patient prepare for a visit? There's a very small allotted amount of time, actually, when you think about it. You want to talk forever and never and never with patients, but we're only allowed a little bit of time. We want everybody to get the maximum out of it. So we've come up with a few tips on how to maximize your visit, get what you want out of it, and how to organize yourself. It's just like anything else, going to do anything, you want to be organized, etc. So we've got a few ideas. Dr. Wu, when a patient comes to you, their story can sometimes be a little convoluted and difficult. Do you have any tips on like how they can get it across?
Well, I think the way I see visits, as two parties come together, we as a physician want to help you, a patient to be able to help you regarding your problem. But I think I always suggest to patients when they come is maybe just almost like going to a meeting, that you have some organization as far as what you're trying to achieve, what's your concern, and to that end, I advise patients to be organized. Organization help us to to devise the treatment more effectively, because I'm sure you do the same thing. Is that we tell a patient that this is a therapeutic relationship. It's not just us telling you what to do. We actually need your help. We can't do anything without you, to be honest. And that's is somewhat funny, but it's also true. So if patient can come here, see us, and be more precise, and if there's a multiple problem, be able to prioritize what is most concerning to he or she, and then let us know, and we'll kind of address. And maybe we're not going to be address everything at one visit, but as we know the problem, we'll work down the list as we go. And that's probably one of the biggest suggestion I have. And also in terms of the story and the history, be succinct.
Yes.
Be clear, and because the more vague is it, and I think sometimes it takes us more time to try to decipher, and almost like decipher code, what is more important. So if you actually come and tell us, oh, my neck pain is the worst, this is the most important, hey, it gives me some clear direction where to start.
I was telling my patient I want them to bring three things.
Mm-hmm.
One, I want them to bring a succinct story. How the pain started 24 years ago when they tripped down a stair and the garage is not as important as, say, this is where my pain is. It hurts when I do this. It goes down here. The more succinct you can actually be, the better it is, the better we're going to be in diagnosing the problem. We want to know exactly how the pain limits your function. If you're able to tell us precisely what's limited, I cannot sleep because when I lie on my left side, my hip hurts. That's an incredibly precise story. Precise stories yield precise diagnoses. Precise diagnoses point us in the right direction, get us quickly to the resolution. So there's three things. One is a concise story about the thing that limits your function. The first. Second, you must bring the imaging related to the problem. So if you had an MRI, I want you to bring your disc or your films, and definitely the report. And I don't want you to just bring them the first time you see us. I want you to bring them every time. Slip that CD in your pocket, put it in your purse, and bring it every time. In case things change, we want to look at that imaging. It's very important. Lastly, we want you to think about what you want to get out of the visit. I always ask for three questions. What is it that you want? Explain to me what discogenic pain is. What's the likelihood that I'm going to get better? When can I play golf again? Those questions like that, for example. I want you to come away having some more knowledge. And that's key to me. What are some things that, how else can folks help themselves?
Well, I think, in this days and age, as much as I hate to admit, but insurance actually plays a big role in terms of how we can deliver care. It's not the best thing, it's not the one thing I like to hear, nor I like to see that, but that is the reality of today's care.
Mm-hmm.
more and more frequent, and often now I find that the insurance company require, even just for a visit, that they need a referral from their primary care physician. I will always suggest that or advise that you check with your insurance company if you need a referral to come see a specialist, because a lot of times we cannot see a patient because there's no referral from the insurance company, and this is our hospital policy, and that we had to go with that. But the other thing is, I would say, if you have never tried physical therapy and this pain is being less than 3 months, fairly acute reason, I would say try maybe ask your primary care doctor to start you with some physical therapy, or if you have went to a chiropractor, ask him to maybe obtain an MRI or obtain a further study. This way, the more information we have at hand, when you come for a specific problem, we can actually facilitate treatments accordingly, and actually faster and more efficient, rather than had to start from everything from scratch, and that actually a lot of time the patient actually end up suffering more. What do
I
you think?
agree. No, I completely agree. If you come with imaging already ordered, you've tried a few of the easy things to do, the diet, the rest, exercise, physical therapy, those things, tried a few different medicines, we're going to get much more aggressive much more quickly. It's good to do those basic things with your primary care doc. Come with a well laid out plan, come with questions, come with your imaging. I think you're going to walk away much more satisfied with your visit with us and make our jobs a lot easier.
Yeah, and we talk about this mainly to increase our efficiency in terms of treating you. I mean, we love to talk to you, we love to hear from you, and love to actually sit down and chat with you. But the reality is that sometimes our main objective is to help you feel better. And there's always going to be time where we can sit down and chat, but in a visit, this time sometimes limited, especially nowadays. It's getting shorter and shorter, it seems like.
It is. And we're going to have a relationship. It's not just this one visit. You're going to probably come back and have to see us a time or two, maybe more frequently or more lengthily than that, depending on the problem you have.
Yeah.
So this will be a relationship that we develop together. But being organized is by far the best thing that you can do when you come to us. Be succinct, organized, bring the data.
Yeah.
Thank you.
Thank you.